Hello, family and friends and members of the sickle cell community. Good morning, good afternoon, good evening, wherever you're listening from. How have we all been? I know, living with sickle cell anemia, it's a job on itself, but I do hope and I do pray that yes, we will all get better over time. I have a bit of, will I say, a rant now, or let me just say I have something to say. This affects everybody living with sickle cell anemia, including myself. There's this attitude that I've noticed with warriors, especially when they come to the hospital in crisis. Um, I also live with sickle anemia, and I know the pain can be debilitating, it can be devastating. You understand? But in as much as possible, please, we should learn how to comport ourselves, and we should learn also not to throw tantrums and also make or create a scene where we are trying to get some relief, some pain relief. But recently, I've interacted with a few of my patients, and the way some of them behave actually, leaves it for people to label and to stigmatize people living with sickle cell anemia as drug seeking and all what not names that I can call people living with sickle cell anemia because of the behavior of a certain few. I know the pain can be very, very debilitating. It can be deleterious in some instances, you understand? But there's a way in which pain is being managed when it comes to management of acute pain in sickle cell anemia, depending on the type of pain and also the medications that I have to take, depending on the degree of the pain. I had this personal encounter, let's just say with patient X, who came in with features that was suggestive of an acute pain or acute VOC. No apparent cause anyways, but of course we know sometimes in sickle cell anemia that can happen without any obvious cause. Patient can come in with serious pain, not from dehydration, not from infection, not from anything else, not even from emotional response. So, of course, the guidelines for pain management have to be followed, in which we follow what we refer to as an analgesic ladder or analgesic rung. And this person had, patient X, so to speak, had up to the highest form of analgesia. Within 24 hours, has had up to 4 or 5 doses of a very strong opioid, and yet the pain was not controlled. So we had to be moved to a patient-controlled analgesia. And what I mean by patient-controlled analgesia is that you are responsible for your pain management. And even at that, using a patient-controlled analgesia in which patient X had like 4 bottles of the PCA, pain was still not controlled according to her response. Then we had to do a red cell exchange transfusion for her using the apheresis. We did that with 6 units of blood, and then she now had, patient X rather, had 2 units of blood topped up this period. Everything we did basically was to remove as much as possible the number of circulating sickle cells and replace it with healthy cells. But even at that, pain was not controlled. Everything I said now spanned 2 weeks duration. Now tell me, I know that sickle cell sometimes, yes, crisis can last quite a long, but within 2 weeks, with all this medical intervention, yet this person still came out near naked, rolling on the floor, operating the seal, throwing tantrums and stuff. You understand? It gives others a bad image, and those kind of image in the minds of health workers. Anytime they see any sickle cell patient or somebody with sickle cell anemia, they just stigmatize them by just attention seeking, drug seeking, and whatnot name that can label us. So I implore us, please let us comfort ourselves. The pain is debilitating, yes, I understand. You can cringe, you can form, you can sit in any position that can help you manage the pain. You understand? But please, we should not be a nuisance when we are seeking for help in the hospital, especially in those acute periods, acute moments that you need those medications to keep calm. Like I always say, the pain medication is actually not the mainstay of treatment. It's your fluid therapy that's the mainstay of the treatment. The pain medication is just to give you some moment of respite, some relief, you calm down, and then allow the fluid to rehydrate your body. Once those cells regain their normal shape back, blood flow is restored, and of course the pain starts to disappear. That's the mainstay of the therapy, not the pain medication itself. So please, I urge us all, let's learn how to comport ourselves. I also live with sickle cell, like I said, and I know I can tell you how the pain can be. any experience you think you have gone through, I've been through it as well. But this message is for even if just the one person out there. Please just to learn how to comport ourselves while we're in pain, while we're in the hospital. Thank you very much for your time. And I think going forward as well, we will be doing more updates with life living with sickle cell anemia and also how to manage sickle cell pain at home. Thank you very much once more, and you have a blessed day.